Millions of women in the U.S. suffer from atrial fibrillation, the most common heart rhythm disorder. Women with AFib are at twice the risk of death compared to men. May is Women's Health Month, so just in time, I've got joining me now Dr. Samil Osa and his AFib patient, Kathy Foster. Good morning.
Good morning, Jessica.
Good morning.
So, Dr. Osa, what is AFib and why are women often misdiagnosed?
So like you said, atrial fibrillation is the most common heart rhythm disorder in human beings. About 6 million people in the United States currently have atrial fibrillation. Symptoms vary widely from palpitations or the feeling like a fish is flopping around in your chest or your heart's racing, to shortness of breath, to basically something more vague such as fatigue. Women tend to have the latter of those symptoms. They tend to be just more fatigued or have shortness of breath and often attribute it to other diseases or other events in life, just getting older or anxiety. So they often don't seek treatment until later in the course of the disease. This not only makes it a little harder to treat, but it also increases their risk for stroke. Atrial fibrillation increases your risk for stroke about 5 times somebody that doesn't have atrial fibrillation. So when you're untreated and undiagnosed and have atrial fibrillation, that high risk is still with you until you seek proper treatment, get diagnosed, and are placed on treatment for your atrial fibrillation. So it's imperative that women really seek treatment early in the course of their disease. If they have any increase in their shortness of breath or their ability to function, such as climbing the stairs or walking to the mailbox or around the block, if any of that becomes a little harder, I think it's really important you see a physician and not really put it off and attribute it to something that's not important.
Absolutely. And Kathy, how did your diagnosis impact your day-to-day life?
Well, for me, I was diagnosed with AFib, and it's intermittent. It did not happen. It wasn't triggered by something particular that I could identify. So sometimes it would last for 2 hours. Sometimes it would last for 10 hours. But it became very, very debilitating in my daily life. In trying to work, to concentrate, it would literally just stop me in my tracks as my heart rate would go from 60, 70 beats per minute to maybe 150, 160 heartbeats per minute. And it really took me aback every time it happened. And so I had to seek treatment because I couldn't continue on that way.
Now, Dr. Osa, can you tell us more about the treatment route you and Kathy chose to best treat her?
Sure. So initially, Kathy we had to be placed on some medications to try to control her symptoms. She had some other medical problems going on that we had to deal with first, so we put her on some medications. Unfortunately, those medications didn't really seem to help her symptoms that much, which is often the case, and we have to move on to catheter ablation. Catheter ablation is a minimally invasive therapy where we insert a tiny tube through a vein in the leg, just through a needle stick, thread the catheters up to the heart, and the catheters are used to heat up the tissue and cauterize it, destroying the abnormal tissue that's actually causing the atrial fibrillation, thereby alleviating the symptoms of atrial fibrillation and really getting the patients back to where they were before they had AFib. The treatment is minimally invasive, like I said. Everything comes out of the body at the end of the procedure. The patients lay flat for a few hours and then generally are able to go home the same day, resuming relatively normal activities within the next day or two. So it's a really effective, safe, and pretty non-invasive treatment, non-invasive both in the body but as well as to your daily routine.
Well, thank you both so much, Doctor, for your insight, and Kathy for sharing your experience. The website to learn more information is getsmartaboutafib.com.